A general rule of thumb is patients that have like partial rotator cuff tears, meaning the tear is not completely torn in two, generally do well with prolotherapy. So this might read as like a partial thickness tear or even a full thickness tear on MRI, as if there's fibers that are still connected around it and the tear is not retracted. They typically do well with prolotherapy or PRP or some form of regenerative medicine. And so this actually could be something that we would see on ultrasound in someone with a rotator cuff tear. So just to orient you here, this bottom white line, that's bone, okay? And then here, this is the supraspinatus tendon that kind of looks like this tire on a rim. When we see, you see this kind of like maybe a little bit more subtle white line here. When we see that on ultrasound, that's called a cartilage interface sign. And what that means is that there's a rotator cuff tear present. And when we go looking for the tear, we're looking for a couple things. One is, are there still fibers intact? So like all this bright white here, those are all still intact tendon fibers. And we look for that because if the tendon is actually torn, like it's two separate pieces and like one's over here and one's over here, those are called complete tears, which we'll talk about later, which are harder to treat. But patients with kind of like a partial tear, or we just see this cartilage interface sign with fibers intact, that often signifies some kind of partial tear that should typically heal well. Most cases of rotator cuff tears, we often do use PRP, and that's for a couple of reasons. PRP stands for platelet-rich plasma, and that's when we actually draw your blood and concentrate growth factors and cells out of your blood and inject it back into the injured area for healing. When something is torn, not just stretched out, but there's actually a tear, that PRP acts almost kind of like a glue, like a bio glue, to help glue it back together and heal it. And oftentimes, patients that have a rotator cuff tear usually have other injuries in their shoulder as well. Like they do have an unstable shoulder, or they have a labral tear. Oftentimes there are other injuries that respond well to PRP too that we just treat to kind of rebuild the joint as a whole. To follow up on what I just mentioned about a complete rotator cuff tear. So again, that's where literally the tendon is like torn into two pieces. And if you see here, so this is a similar view, like this bright white line, this is the bone, and then we should see the tendon as that kind of like tire on a rim. You see this big black gaping hole here? Well, what's happened is part of the tendon is here. There's all this empty space, and then the rest of the tendon is here. So not only is this tendon completely torn in two pieces, but they've separated. They've actually gone in different directions. This part has retracted back. And unfortunately, regenerative medicine can't grab this piece and bring it over here and then try to glue it back together. We can't do it. So in this woman, she maybe was like in her 50s, but very active, very involved in tennis and things like that. And so I ended up sending her to the orthopedic surgeon for a surgical consult because she's gonna need a strong shoulder. You can't really play tennis on a shoulder that has a chronic injury like this if it doesn't get better. So I sent her for ortho. There are times where I'll see patients, they're like 85, 90 years old. They've got complete tears. They're not surgical candidates. They're not gonna have surgery even if they were. And all they wanna do is just have less shoulder pain, to do normal things like cook or do a puzzle. So there are times where we will treat this knowing that we're not going to be able to get this tendon back, but hoping to work on strengthening everything else in the shoulder to help minimize pain. There are times that we'll do that, but in general, if you're a young, active, healthy person, you might have to get this surgically fixed to meet the goals that you want.